Good evening, all. Welcome to my channel Basics of Pharmacology. Today we are going to discuss about organophosphorus poisoning. Friends, this is the most common type of poisoning found in India. It can be through homicidal, through suicidal, or accidental. So today we'll discuss in detail about organophosphorus poisoning. These are also called as acetylcholine esterase inhibitors. So this diagram shows the most common type of organophosphorus poisoning used in a day-to-day lives, and which are most commonly used as a source of homicide or accidental poisoning or suicidal. So how do we get this organophosphorus poisoning? It can be through occupational exposure, means the farmers through while working in the fields can get exposed to this organophosphorus poisoning. Secondly, it can be used in a terrorist attack or in case of a military attack. Third, there can be an iatrogenic cause. Accidentally the bottles might get open, or there might be accidental exposure, or it can also be through contamination of food. Now, some of the examples of this organophosphorus poisonings are insecticides, malathion, parathion. Then nerve gas, this was used in an attack, that is soman, tabun. Third is through ophthalmic agents, that is ecothioplasm. Some anti-helminthics, that is trichlorphon. Herbicides like tribofos. Then there are some certain industrial chemicals like tricrysyl phosphate. Unfortunately, it has been used in the militaries or for an attack purpose. It is used as a weapon for a mass destruction. Now these are the names of the drugs, that is edrophonium, neostigmine, physostigmine, pyridoxine, disofluorophosphate, ecothioplasm. Mainly edrophonium, neostigmine, physostigmine, pyridoxine, they cause reversible poisoning, that is, and they have got short duration of action, whereas ecothioplasm and disofluorophosphate, they cause irreversible organophosphate poisoning. Now, one of the common organophosphates is malathion. It is most commonly used in case of agriculture used by the farmers. So this poisoning can be through the exposure of poison through oral route, through inhalation, through skin, eyes, and it can give rise to a toxic metabolite. So basically these organophosphate compounds have got two sides. One is the esteric site and second is the anionic site. This organophosphorus compounds, they go and they bind to the esteric site. Now mainly they are used in warfare agent, that is tabun, sarin, soman. When you see these organophosphorus compounds, they are clear, colorless, odorless, tasteless, and they can easily get vaporized, but they are highly toxic. Now this is the figure which shows that this organophosphorus compound was used in 1995 in the Tokyo subway attack. Now what happens basically in organophosphorus compounds? This causes irreversible bonding, and whenever this organophosphorus compound is taken, it goes and it gets bind to the esteric site and it causes inactivation of this acetylcholine esterase. So what happens? There is an irreversible binding which causes inactivation of acetylcholine esterase, and as a result of this there will be excess accumulation of acetylcholine, and which will ultimately give rise to cholinergic crisis. Now friends, this is a figure which shows a person suffering from organophosphorus poisoning. You can see that there are lot of discharge, because they're in the form of frothing, vomiting, and muscle muscle paralysis, twitching can be seen, and all the features of organophosphorus poisoning. Now these are the receptors on which this compound acts. Now, the easy way to remember the symptoms of organophosphorus poisoning, mainly it causes two effects. First is the muscarinic effect and second is the nicotinic effect. The mnemonic to remember the muscarinic effect is sludge PV. That is, S stands for salivation, L for lacrimation, U for urination, D for diarrhea, G for gastric pain, E is for emesis, B for bronchoria, another B for bronchospasm, and the last B is for bradycardia. By this, you can just remember the clinical features of organophosphorus poisoning. Second is the nicotinic effects. Nicotinic effects you can just remember through the days of the week, that is Monday, Tuesday, Wednesday, Thursday and Friday. Monday is for mydriasis, Tuesday is for tachycardia, Wednesday for weakness, Thursday for hypertension, Friday is for fasciculation. Now, how do we diagnose organophosphorus poisoning? First is through clinical diagnosis. When the patient comes to the hospital, clinical signs and symptoms, and through the history, we asked the relatives about what type of poison he has taken, the amount, the type of poison. Sometimes they, if it is a suicidal or even if it is accidental, they bring the poisons along with them, so we can identify which type of poisons are there. And secondly, what we go through is through laboratory tests through ABG by finding acetylcholinesterase. ECG is performed and various lab investigations for confirmation of organophosphorus poisoning. Now, what action should be done? Immediately as soon as the patient arrives in the hospital, first we have to check the basic things, that is A, B, C, D, E. A stands for airway, breathing, B stands for breathing, C for circulation, D for disability, and E is for exposure. And right away we have to start the treatment. Now the treatment consists of firstly decontamination, means as soon as the patient arrives we can just smell the poison, so we have to remove change the patient's clothes. Then the doctor examining should definitely use a PPE kit, gloves, and all precautions should be taken. Now, what is the pharmacotherapy of organophosphorus poisoning? First and foremost, the most important drug in this case is atropine. So, atropine, it acts as a competitive muscarinic inhibitor. The dose of atropine is 0.05 milligram per kg and it should be given through IV. Atropine, it dries the secretion in cases of organophosphorus poisoning. Now this is the figure which shows what happens, that acetyl coenzyme A, it combines with choline and it gets converted to acetylcholine. This acetylcholine is then released in the synaptic cleft and this acetylcholine then binds to the cholinergic receptor. Then there is something which is called as acetylcholinesterase enzyme, which degrades this acetylcholine into choline and acetate. Now what happens in organophosphorus poisoning? We are inhibiting this acetylcholinesterase. So whatever treatment we give, they are called as acetylcholinesterase activators. So second is pyridoxine. Paradoxine, it covers both nicotinic and muscarinic actions. And secondly, it is also called as cholinesterase reactivator. What does it do? It reactivates this acetylcholinesterase enzyme. And there will be a regeneration of an enzyme and the reactivation. Third treatment is for convulsions, we can give benzodiazepines. Now activated charcoal was the most common, even nowadays we use in case of organophosphorus poisoning and in many cases of poisoning except the corrosive poisoning, that is we crush the charcoal and we push through Ryle's tube. The main action of this charcoal is it acts as an adsorbent and it adsorbs all the toxins whichever is left in the stomach, and whenever we push out the contents through the Ryle's tube, it gets removed from the stomach. Now another principles of management is, first we have to maintain the airway, we have to start oxygenation, and if the patient is highly hypoxic we have to intubate the patient and put the patient on ventilator, that is artificial respiration should be given, and most important treatment is atropine. Then secondly, pyridoxine is given, which is also called as acetylcholine esterase reactivator. Then respiration has to be supported. One important thing is pyridoxine should be given within 36 hours of exposure, as if we give after the 36 hours, there will be possibility that it will lose its alkali group, and it is said that it undergoes aging and it loses its alkali group and it doesn't act after 36 hours. Another is the support for respiration. Again, pyridoxine can be given and atropine, and we can take the help of the ventilators for respiration. For seizure activity, mainly the patients of organophosphorus poisoning gets convulsions. For that we can give benzodiazepine, diazepam can be given. One important thing that we should first help ourselves, that is we should protect ourselves so that that poison doesn't get absorbed to the skin. So appropriate sterilization techniques, gloves, gowns and PP kit should be worn. And the patient should be isolated, decontaminated. The clothes which the patient have come wearing it should be discarded and should be thoroughly washed with soap and water. So thank you for today's this much here we end with the organophosphorus poisoning. Please like, subscribe my channel and share. Press the bell icon. Thank you for now.